Good evening, everyone. Welcome back to a new post today, and let's continue a few more topics of the social issues with regard to the DSPSC mains group 1 examination. So let's today speak about fluorosis, and we all know that the Sustainable Development Goals speak about clean drinking water and access to sanitation as well. Clean drinking water is a part of the right to life in Article 21 of the Constitution, and this has been made evident by the Supreme Court many a times. Fluorosis is one of the main drinking water problems faced by many states, not only Telangana and our neighboring Andhra Pradesh, also in India. So Sustainable Development Goals speak that by 2030 there should be universal and equitable, safe, clean access to drinking water for all, and we hope that India achieves this goal much before in hand. So what exactly is fluorosis? Now, it is a public health problem that is caused because of excessive intake of fluoride through food or to drinking water for a very long extended period of time. Fluorosis is caused by ingestion of a high amount of fluoride through food or water, and it is a major public health problem in India. It results in significant health issues like dental fluorosis, skeletal fluorosis, and non-skeletal fluorosis as well. Lack of drinking water puts about 11.5 million people in India at the risk of fluorosis, a crippling bone disease. To make provision for potable drinking water in adequate quantity so that the water-related problems such as fluorosis are dealt with, and also of a prescribed quality and on a regular and a long-term basis to every rural household by 2024, Government of India started in 2019 along with the states and the union territories the Jal Jeevan Mission Har Ghar Jal Yojana. While the Jal Jeevan Mission is allocating funds to the state and the union territories, 10% of the weightage is given to population residing in the habitations affected by chemical contaminants, including the fluoride. The Union Health Ministry started a program also under the National Program for Prevention and Control of Fluorosis in association with the Ministry of Drinking Water and Sanitation, and has started a survey to assess the actual burden of this disease in identified states. Fluoride prevalence was early reported into 30 districts in the India of 19 states. As per the present data from the Ministry of Drinking Water and Sanitation, there are about 14,000 plus habitations from 17 states which are yet to be provided safe drinking water. The population at risk based on population of habitation with high fluoride is about 11.53 million. The states which are affected with fluoride are as follows. So nearly 54% of the affected habitations are in Rajasthan itself. In each of the 5 states of Rajasthan, Bihar, Madhya Pradesh, Tamil Nadu, Punjab, more than 200 habitations are affected, and these states together account for 83% of the habitations affected by fluoride contamination as of 2020, and this data was given by the Ministry of Drinking Water and Sanitation. Uttar Pradesh has 75 districts, Madhya Pradesh 51, Bihar 38, Rajasthan has 33 districts whose people are at risk of very high fluorosis. The teeth can be chalky white or may have white and yellow, brown, black spots or streaks on the enamel surface. The Geological Survey of India has also identified some red alert high fluoride zones in India. They are the Nalgonda district of Telangana, Gurgaon, Hisar, Fatehbad, Mahendragarh and Rewari districts of Haryana, Fazilka, Jalalabad, Firozpur in Punjab, Dindigul in Tamil Nadu, Sindh district of Madhya Pradesh, Bhid district in Maharashtra, and parts of Unnao, Rai Bareli and Sonbhadra in Uttar Pradesh. Over 19 lakh population in Nalgonda of Telangana are with the risk of high concentration of fluoride found in the groundwater. About 1108 habitations are severely affected. In this regard, the district administration has taken several measures to mitigate the problem of fluorosis, and one of the main steps, also the very first time in India, is the District Fluorosis Monitoring Center, which was established, and it is a very unique thing with regard to district administration in Nalgonda by bringing convergence and facilitating interdepartmental coordination for mitigation and prevention of fluorosis in the district through a concerted effort in integration of resources. The UNICEF has been involved in strengthening this center, this fluoride monitoring center at the district level ever since its inception by extending technical and financial support as required, planning and implementation of action plans, and also building the capacities of the functionaries. What are the adverse effects of fluorosis? So excessive exposure to fluoride in water or either food can cause dental fluorosis, skeletal fluorosis, thyroid malfunctions, abnormalities in the babies that are born to women with fluorosis, gastrointestinal disturbances, anemia, allergic manifestations, calcification of ligaments and the blood cells, abnormality in the sperm. Excessive exposure will increase the risk of hip fractures, teeth damage and osteoporosis. So these are the effects. The center at the district level is a very unique model and a pilot project in the entire country itself. And though about 125 districts in 22 states are affected by fluorosis problem in the country, there has never been such a district center at the district level as in Nalgonda, except in Nalgonda, to bring forward the concerted efforts through convergence approach of prevention and mitigation of fluorosis. As mentioned, that the district level fluorosis management center has quite a consistent impact since its inception, and recently our very own Minister of Telangana, K.T. Ramarao, has said that there is a reduction in the fluorosis problem in the state. Safe supply and fluoride-free drinking water provision to severely affected 1108 habitations and to all the schools and hostels and Anganwadi centers is being taken up by the Telangana government. There has been the success of the mission Kakatiya, and fluorosis is dealt with this. The fluoride content in the groundwater in the fluoride affected areas of Nalgonda district has dipped to at least 50% due to an improvement in the groundwater levels, and this is thanks to Mission Kakatiya of the Telangana government. The state government has already succeeded in stopping new fluorosis cases in the district by supplying safe drinking water to every house in fluoride affected districts through Mission Bhagiratha. It has also taken up the work on Shivanagundam reservoir aimed at bringing the fluoride content to a normal 1.5 parts per millions in the groundwater of Marigudam, Chandur and Nampally mandals. The usage of groundwater has also fallen sharply after the state began the supply of drinking water to all the fluoride affected villages under the mission Bhagiratha. At the same time, about 142 irrigation tanks were restored under the mission Kakatiya at Marigudam, Chandur and Nampally, which were the worst affected fluoride areas in the district. The two factors that led to improvement in the groundwater levels in turn leading to dip in the fluoride content in groundwater as well. Now further, the Ministry of Housing and Urban Affairs, as under the middle mission called as Atal Mission for Rejuvenation and Urban Transformation, as for the period of 5 years with the objective of providing universal coverage of water supply through functional household tap connection to all the statutory towns in the country. And Sustainable Development Goal 6 says that access to safe water, sanitation, hygiene is the most basic human need for health and well-being. Billions of people lack access to these basic services in 2030 unless the progress quadruples. Demand for water is rising because of rapid growth in population, urbanization and also increasing the water needs from agriculture, industry and energy sectors. Therefore, safe drinking water, clean drinking water, tapped water to the households, not only the urban areas but rural areas, not only rural areas but also the urban areas as well, will only deal with this program. And we look forward to Government of India and also the state of Telangana to completely eliminating this program with regard to safe drinking water, so that we have a healthy population which can achieve the goals of sustainable development. So this is with regard to fluorosis, and I hope this content was really helpful to you all. If you did, please do like, share, subscribe, and please do not forget to comment. And I shall see you with a very important topic for tomorrow, and something other even something extra that is going to help you with regard to your TSPSC. And until then, it's very happy learning.